Catching cancer at its earliest stages, when it's most treatable, can save countless lives.
Every time a new innovation comes along, it gives us even more capacity to help patients faster.
Things that would take 2 years are taking 2 months. Massive material science problems, drug development problems. We're shrinking the time to solve.
There's so much excitement in the world of AI when it comes to the world of health.
We're using artificial intelligence to find cancers and save more people's lives.
The ability to help us survive things that were unsurvivable before.
I think this is a moment that we'll look back on as one of the most important and profound changes for human history. My name's Neil Daly. I'm the founder of Skin Analytics. We're a company that builds AI as a medical device solutions to try and help more people survive skin cancer. There's a huge mismatch between the people who need to be assessed for skin cancer and the people who can do it. And that's a really, really high emotional toll for people to pay while they wait to get to the person who can actually tell them they're okay. Within our company, every single person is motivated by the idea of doing something that matters. The artificial intelligence we've developed is able to diagnose skin cancer within the hospitals, but increasingly at home with kits that we're sending out to patients. We use a smartphone with a camera, and then we use a lens which clips onto that smartphone and allows you to see some of the features that are just below that top surface. We take an image of the skin lesion, we upload it into the cloud. The algorithm itself starts to pull apart the image and try and identify the cancer. And within seconds, we have an answer. And then it sends back a report which explains what we think it is and what we think needs to happen next.
All of a sudden, you have this technology that makes it possible to deal with the complexity and the volume in a different way, particularly the organic data that is related to the research and development in the medical field. That organic data has always been a challenge because it's so big.
When doctors say, hey, you might actually have cancer and we're going to look at it just to be safe, what that does to a person is quite profound. They don't think, oh, I'll wait 2 weeks to find out if I have cancer. They spend 2 weeks thinking that they have cancer. One of the things that we can do, not only can we find cancer sooner, but we can really ease that stress of, do I have something seriously wrong with me right now? One of the interesting parts of our business is we're asking patients and clinicians to trust a computer to do something that only specialists with 15 years of training could do. One of the things that is really important for us is getting an incredibly high quality image. And we do that in a couple of different ways. We have a bunch of checks that the algorithm does of the image to make sure that it's right. Within our data set, every single cancer has been confirmed by histopathology, so that we don't label anything as cancer without the evidence that it definitely was.
When we look to integrate all forms of AI into health and research, it's critical to ensure that human safety is centric to all types of innovation. So that could be the guardrails, the training, the fine-tuning of these models.
We're able to do that at a speed that humans couldn't before. So the role of humans will change again, but we're still going to be in the orchestrating role and the final judgment role.
We don't see a world where dermatologists are ever replaced by technology, but we do see a world where we change the way that we deliver care.
Whilst different technical skills will evolve as time goes on, what is a constant is those human skills, to apply critical thinking, to apply judgment, to be empathetic. Those skills are always high in demand.
I think that the future, the opportunities that artificial intelligence brings us are going to be so immense when it comes to healthcare.
Now you have this opportunity to start creating very, very different solutions to unlock value in healthcare organizations that right now is wrapped up in processes, scheduling, and facilities, all these places where AI can actually improve the experience of the healthcare environment.
By focusing on a very specific problem with artificial intelligence, we've been able to build a lot of effectiveness very, very quickly. We've learned a huge amount about the skin that we can now reapply to see what else that we can affect. What else can we find?
It allows the people who are trying to solve problems to solve more problems, bigger problems.
We're going to start to see just amazing new ideas, new research, new development. AI will help conduct new research, then automating the research itself.
Leveraging powerful AI can envision a future that's precise and sensitive, but more importantly, very accessible. Detection of cancers is not just a hope, but it's actually a reality.
I'm very proud about what we're able to do materially to make a difference in the healthcare system today.